Welcome to this information session on routine pregnancy test. Dr. Rinku Sen Gupta, consultant obstetrics at Sitaram Bhartiya Hospital, is here with us. Dr. Sen Gupta will share information regarding common questions related to pregnancy test. What are the tests done during pregnancy? What are the common tests?
You see, tests are done during pregnancy. The reason is that although usually pregnancy is quite uncomplicated and uneventful, and basically it is a normal physiological process, but 10 to 15% of the time the pregnancy may be complicated with some conditions, high risk conditions, like your blood pressure may become high, your sugars may become high. So it is important that we do some tests in order to pick these problems early, and although we cannot prevent them from happening, but we can prevent some adverse sequelae from happening if we catch hold of them early. So these tests are usually divided trimester wise. Like we talk about tests in the first 3 months, we talk about tests in the middle 3 months, and then we talk about tests in the last 3 months.
You mentioned that these tests are divided trimester wise. So which of these tests are done in early pregnancy, as in the first trimester?
You see, some of these tests are done as a routine screening. That means some tests are done or offered to all women, and there are some tests, special tests, which are offered to some women based on their ethnicity, based on their family history, based on the results of the initial screening tests. So in the first trimester, when a woman comes to us, that means in the booking visit, we offer some routine tests like a hemoglobin, a blood group, a blood sugar, and HIV to rule out certain infections like HIV, HBsAg. We usually would do a rubella screening, which is the German measles. Each of these tests have their own significance, and sometimes we also offer a women a routine thyroid. Apart from that, a hemoglobin electrophoresis is offered in order to rule out any thalassemia carrier status or a sickle cell carrier status.
And which are the tests that are done in the second trimester? Can you just explain those?
Yeah. Now in the beginning of the second trimester, that means when you're about to begin the second trimester, that means around 12 to 13 weeks, we offer a test which is called a combined test. This is basically a genetic screening test, and what is offered is a blood test along with an ultrasound. And this combined test would usually tell an expectant mother whether she is at high risk or at low risk of having Down syndrome. Down syndrome is a genetic problem which is not very common when a woman is young, but it becomes more common as you grow older. And in fact, the risk of having Down syndrome can go up to 1:100 when you are 40. So this routine genetic screening test can tell you whether you are at high risk or at low risk of having a Down's baby. If the risk is high risk, then we can offer some confirmatory tests to this expectant mother.
And what are the tests that are done in the last third trimester?
In fact, before I go on to the third trimester, I must tell you that another very important test, which is very important especially in Asian women, is a glucose challenge test or a glucose screening test, because pregnancy is a diabetogenic state. And a lot of mothers ask us, why you want to do sugars? I'm not diabetic. But the problem is that in pregnancy, certain hormones are secreted in your body, and your blood sugar levels may go up, although you are not essentially a diabetic. And once you deliver, the sugars may come down again. So between 24 to 28 weeks, we would offer you a glucose test, a glucose tolerance test. And this is basically done to see whether your sugars are high. Because if sugars are actually high, then in pregnancy we have to take certain precautions like diet restriction, etc. And this will go a long way in protecting the baby from having any adverse effect because of high sugars.
So it's after this, what are the tests in the third trimester?
In the third trimester, you see what one is really concerned about is the fetal well-being. And the mother is generally asked to keep her own fetal movement count, just to have an idea. If the mother feels that the fetal movements are less or there is any issue, then we sometimes offer additional tests. One test that I missed out in the second trimester was a level 2 ultrasound. You see, an ultrasound is very important in the second trimester between 18 to 21 weeks, because we want to basically rule out any anomalies, any organ anomaly or any genetic problem. Even the Down syndrome screening is further enhanced in this level 2 ultrasound. Now, in the third trimester, we would offer ultrasounds if we feel that the mother's movements are less or there is any concern about the fetal well-being. Otherwise, in a low-risk mother, obstetric ultrasounds are not routinely offered. But if the mother is high risk, like we were talking about gestational diabetes or high blood pressure, we would offer some routine obstetric scans to see whether the baby is growing well, whether the water around the baby is adequate, that means the placental function is good, and sometimes in some situations a Doppler ultrasound to see how well the blood flow is from the mother to the baby, which is called a Doppler ultrasound.
You mentioned that you do a level 2 ultrasound at second trimester. Are there any other screening tests or diagnostic tests that are required to detect a birth defect in the baby?
Yeah. You see, the thing is, we just talked about the combined test and we talked about the level 2 ultrasound in the second trimester. Now, if there is any concern in the combined test or sometimes even in the level 2, especially if there is a concern about Down syndrome, the mother is high risk, then we offer a amniocentesis. Amniocentesis is an invasive test and the fluid around the baby is tested for the genetic makeup or genetic status of the baby. So this will kind of confirm Down syndrome, and then it is up to the couple, up to the expectant mother, what they want, because it is a genetic problem, it has long-term implications, the baby is going to be mentally retarded. So the expectant mother can be offered termination. Whether she gets it done or not is of course totally her wish.
In the third trimester, there is a very common test which is known as non-stress test. Can you just explain us about that?
Yes. Non-stress test is not an ultrasound test. Non-stress test is again a test of fetal well-being. If the mother is complaining of decreased fetal movements, then what we do is we check her fetal heart rate with a Doppler transducer, and what we actually try to see is whether the heart rate of the baby is fluctuating. Normally a fetal heart rate, unlike our heart rate, fluctuates a lot, and in fact the heart rate can vary from 110 to 160 beats per minute. And this is a good sign. That means the heartbeat is fluctuating, that is showing the variability. Minute to minute there is a fluctuation. Now when the baby moves, the heartbeat suddenly jumps, say from 120 to 130 or 140. That means there is an acceleration or there is a rise in heartbeat. This is a sign of a healthy baby. A non-stress test basically means that you are not stressing the baby by giving any external stimuli. You are just watching. Whenever the baby is moving, is the heartbeat moving up to the required level.
What is a biophysical profile and how is it performed?
A biophysical profile is again an extension of ultrasound. Now the idea behind biophysical profile is that we look at a lot of other parameters and not only on one parameter like we do in non-stress test. In non-stress test we are only looking at the fetal heart and the fetal movement. In biophysical profile we are actually looking at a lot of other parameters, because it is on ultrasound. We can see the water around the baby, whether it is adequate or not, whether the baby's movements are happening, gross body movements, whether the baby's tone, the flexion extension movements are adequate, whether the baby's passive chest movement, which we call the respiratory movement, is happening. So basically we give a score to the mother. If all these are okay, then we give a score of 8 out of 8, and a score of 6 to 8 is considered quite good. But if the water around the baby is less, the other parameters are fine, even then this baby has to be kept under supervision. So basically a biophysical profile tells you about fetal well-being. If it is satisfactory, we are happy that the baby is fine and we don't need to worry, because sometimes the mother will be so anxious, I'm having less movements, and we don't want to intervene unnecessarily. We don't want to deliver her just because she is saying less movements, although it may be just her perception or maybe some change in her pattern that day. But if the biophysical profile is reassuring, then we can reassure the mother.
Okay. How is a Doppler ultrasound exam done, and when is it exactly done?
A Doppler ultrasound is again a type of ultrasound examination. It can be an extension of the biophysical profile itself sometimes. That means if you additionally want to do Doppler. Now Doppler basically tells you whether the blood flow from the placenta to the baby is adequate. Now there are certain conditions in the mother, like the mother is having a high blood pressure and the baby is not growing well, and you see a growth lag in the baby, the water around the baby is going down. So we are concerned whether this baby is okay or not. Now if supposing the baby is, every baby grows at a different rate. I mean, a baby who's 3.5 kg at birth may be as healthy as a baby who's 2.5 kg at birth. It doesn't mean that the baby is less healthy. Every baby has its own growth potential. So baby who will grow up to 2.5 kg will have a different growth rate. So just by looking at the growth parameters, you can't make out much. What you really have to see is whether the blood flow which is going from the placenta to the baby is enough or not, and that we can make out by the Doppler. In fact, we can make out whether the blood flow in the other vessels of the fetus is also okay or not. Other than the umbilical artery, we can study the other arteries and veins of the baby to see whether the blood flow is adequate and it is nice or not. Thank you.